morning, everyone. Welcome to sunny San Diego. For those of us from the West Coast, especially, can you hear me? There we go. You got to practically eat it, sorry. Good morning. Welcome to San Diego. I know most of us that are from the Southeast. I'm in Florida. My name is Chip Tam. I'm with the Florida Apartment Association. Are loving the weather out here. So how many of you are appreciating that it's like not a million degrees and you actually get up? Yeah. So let's lobby every year Apartmentalize San Diego, right? With apologies to my counterpart, Alan, who probably would not wish that on himself every year. But welcome. We're glad to have you this morning. On behalf of NAA, I'd like to welcome you to NAA's Mental and Emotional Health Survey, Challenges Facing Today's Workforce. Before we begin, there are some important housekeeping announcements, as always, I would like to remind you of. If you haven't already done so, please make sure that your mobile device is silenced. Make sure you've downloaded Apartmentalize 2022, the event app, to access the schedule and all other conference materials. The app allows you to participate in session polls, provide speaker feedback through session survey, gives you downloadable access to the speaker's slides, and much more. Just search for this session under the Education Sessions screen. All NAA Education Institute credential holders will automatically earn 8 CECs by attending the conference, and your credits will automatically be applied to your account on NAA HQ. Now, without further ado, please join me in welcoming Jen Picotti, John Sons, and Jean Supin.
Thanks, Chip. Appreciate that. So welcome to the mental health survey segment of NAA's Apartmentalize. We're super excited about the survey. Jen and Jean are going to dig into some specifics, but I want to give you kind of a backstory about how we got here today. And I like to tell the story from my perspective, not as John and not as the chair of the mental health subcommittee, but as a mental health patient, because I think it's important to let people know it's okay to talk about that. And I want to take you back just a little bit, back to 2018. Now let's face it, the apartment industry has been a stressful industry since the beginning of time, right? Is anybody going to argue with that? It's been stressful for many, many years. And back in 2018, I was really having a rough time. I had been seeing mental health counselors for several years, which I don't think anything's wrong with that at all. But 2018 was a specifically difficult year for me, and I'll run you through some of the things that was happening. I knew something was wrong when I started driving down roads, and I had no idea why I was driving down that road. Putting dirty dishes in the refrigerator. Putting the microwave, you know your microwave cover plate that you put over the dish? Well, I did it a little backwards. I put the cover plate down first and the dish on top. Pouring liquid laundry detergent with the cup in my hand, pouring the laundry detergent in my hand. And then I noticed through self-observation that I wasn't myself in my conversation with colleagues and family members. Very short, very angry, and I would quickly realize that. And I'm like, you know what, something's going on. Now, things that were going on in 2018 for me, to give you an idea, is what my personal life entailed. I had a stepbrother that had fallen off of a roof and died, so that was pretty traumatic. Those of you, I'm sure there's several in the room that have fur babies at home that are like your children. I had lost 2 of them. I got married to my partner. He and I finally got married after being together at that time 22 years, so that was an emotional high, right? And then the very same week that we got married, my mother died unexpectedly. Talk about a roller coaster, right? And then as we talk about our work-life balance, which is so important when we're talking about mental health, we were working with an owner, and I've been in the business now 34 years. At that time, that was just 3 or 4 years ago, most difficult owner I had ever worked with, and was really putting the stress on us at work. So I had all these other things in 2018 that were going on, and then add that layer. I was a wreck. And decided to go get some help. And they put me through a 5-hour neuropsychological exam. For me to tell you what that entailed, it would take 5 hours because it's pretty intense. And what I learned was I just was not processing my emotions. I wasn't grieving my mother's death or my stepbrother's death. I wasn't enjoying the getting married. I wasn't being able to enjoy that. So my emotions were just all over the place. And I just kind of took a step back. I really started getting involved with NAA more on the national level, getting involved with some committee work, and I was on the operations committee, and I'm like, you know what, we need to focus on mental health. It's time that we focus on mental health. And that mental health subcommittee, they allowed us to form the mental health subcommittee last year, and I was honored to chair that last year, and I'm honored to chair it this year. And I want to say, are there any of our subcommittee members in the room? I know I see a couple of you. The lights keep me from. Would y'all stand up if you're part of that subcommittee? Because these folks, they deserve a round of applause. So thank y'all for what you do. It has been a true team effort. So what we did was we sat back and we wanted to determine who our audience was. Simple, right? It's everybody in the apartment industry. Everybody. That was our audience. So we moved on and we wanted to talk about 3 topics, or focus on 3 topics. And that was making the conversation comfortable, which is why I just told you my story. If I can tell you that story, I know a lot of you in the room, but there's a lot of you that I don't know. And if I can open up and tell you my emotional story and my mental health story, it should be easy for you to tell yours, or it should be easy for you to be able to listen. Fair enough? Right? Recognize your own mental health or help those around you. So the next topic we wanted to talk about was the us and them. And when we're talking about that, that's the residents' mental health and the mental health of our on-site teams. Because how often do they collide? They interact, right? They're always interacting. One affects or impacts the other, so that's fair. And the other was dealing with trauma. We deal with a lot of trauma on site, and we wanted to focus on that. So we conducted a survey back in September and October of last year. Did anybody take the first survey that we did in 2021? Okay, great. Well, I see some hands in the room. And we decided that we wanted to rerun that survey, and we just concluded that. We closed that, what, in April? The second survey, we had a 56% increase in respondents. And Jen's going to share with you some statistics today. She's going to share with you a lot of statistics. And if you're like me, I sometimes shut down when I see numbers. These are very important numbers. And I know Chip asked you to silence your phone, but I think we're going to encourage you to pull your phone out and take some pictures of these slides. And what these surveys, both of these surveys did, was it gave us industry insight into what not only our on-site team members were feeling, but how our corporate and C-suite level executives were feeling, and our supplier partners. So we got a lot of great information out of both of those surveys. And another thing that we wanted to do as a committee was we wanted to develop a relationship with an organization, someone that could help us, because we're not mental health experts, right? We can say we need help. So we looked. James Campbell with NAA helped us recruit and develop a relationship, and we now have a partnership with the National Council for Mental Wellbeing, and that's who Jean is with, and you're going to hear from her in just a little bit. So I think we've done a lot in the first 2 years. We've determined what we're going to talk about. We've done these surveys. We've gotten a flavor for how y'all feel out there. We've developed this partnership. And one thing you're going to hear us talk about this morning and even this afternoon at a 4 o'clock session, we're going to leave you wanting more. There's going to be a session this afternoon. One thing that we've learned in these surveys, if you're a leader, if you hold a leadership or C-suite position, the folks in the field want to know that you're paying attention and this is a focus for you. So you're going to hear me say that a couple of times. If you are in a leadership position, they want you focusing on that. So without further ado, I really want Jen to be able to get into some of these specifics. So Jen, are you ready to tell them what we learned in the survey?
Do this. Hello everyone, can you hear me?
Is it on? Here you go. Try this one.
Check. Hey.
There we go.
Good morning, everyone. You ready to get mental with me? Let's do this. So I am so excited to be a part of this whole session, this whole process. And I'm going to put my phone here so I know what time we're dealing with. We're going to be going over a lot of stats. There's a little clicker. And I don't want you to be scared of them because I'm going to demystify what we're seeing up here because I know a lot of you feel like you're back in algebra class in 8th grade and you're like, oh my gosh, kill me now. But I want to put context around the information that we're going to be presenting today. And I think it's important for all of us to have an understanding of where we are as an industry. I'm so excited that we've had this opportunity to tap into the perceptions and experiences of our industry as a whole. So, my name's Jen Picotti. I'm the Chief Learning Officer with Swift Bunny, and we focus entirely on multifamily and understanding employee engagement. So we just immerse ourselves in how our employees are doing in the rental housing industry. And so to be able to partner with NAA and dive into this aspect of the employee experience has been really, really valuable and really eye-opening. And so I'm excited to be able to share this information with you. I started in the industry in 2000 on the owner-operator side here in Southern California with Shea Properties. That's where I got my start, and I got to really understand how our on-site and our executive team members think and make decisions and all that good stuff. Then I went to the resident survey side with Satisfaction and ApartmentRatings.com and got to understand the weird and wonderful world of the resident mind and how that works. And now I get to focus on our multifamily employees. So it's this interesting 360-degree view of how our industry operates. And so that's the lens that we're able to take a look at this information and say, how does everything interact with everything else and impact each other? And how can we support this? So we've got a poll for you real quick. If you want to take out your phones and follow this QR code, I'm really curious to find out, did your company invite you to participate in the NAA Mental and Emotional Health Study this spring? And there's 3 options. Yes, we were invited to participate. No, we weren't invited to participate. Or this is the very first time I've even heard about this study. So go ahead and we'll give you just a minute to participate in that. And as soon as we get a good level of responses, we're going to throw up our responses on the screen. And can I just say, you're looking good this morning. And I know some of you were late night activities. So thank you for being here. All right. So over 50%, this is the first time you're hearing about this study. That doesn't make me sad. That makes me like, all right, we've got a whole new audience we can tap into as we continue to explore this topic. But we had 27% say yes, we were invited to participate, 21% no. All right, this is good. We can move on to the data. Let's do this. So for the spring study, we had over 3,600 participants across our industry. Now, for those of you who are total data nerds like myself, you will be excited to know that this is a plus or minus 1.8% margin of error with 99% confidence. Now, for those of you who care about those types of things, you're going to look at that and be like, wow, we got some good data. For those of you who have no idea what this means, all you need to know is, wow, we got some good data. That's all that means. And this was an increase, like John said, of 56% over the fall study. So we did the study in the fall. We gave it about 6 months because we knew that the things were starting to feel more familiar. You know, at the fall, we started to see the moratoriums ending. We saw some of the restrictions ending. So we were starting to feel like, okay, business is starting to look more familiar. I never say normal because really, what is normal right now? That doesn't exist, but it's more familiar. We know how to do business in this environment. And the way we do our studies is we take a 2-dimensional approach. And I've been doing surveys for about 15 years now with Doug Miller. Some of you may be familiar with him. And we've developed this approach because it's so important to provide context. So what we do in our surveys is we give a positive statement, and we ask our respondent, how much do you agree with this statement? Because we want to know what your experience is. And then we want to know, how important is this statement to you? Because if you really agree with something, but it's not that important, I don't want you to spend time on fixing that. But if it's something that's really important to you, but you don't agree with this statement at all, that shows a big gap. We're out of alignment here. That's something that we need to focus on. So that's how we approach all of our surveys. So we saw some great improvements over the fall study, which we were really excited about. We saw things kind of calm down a tiny bit. In the fall study, we saw a lot of extremes. Everything felt really, really, really important, and they disagreed really, really strongly with the different situations. And while we still have some gaps, it feels like things have calmed a little bit. It's not quite extreme on either end of the importance and agreement spectrum, which gives me a lot of optimism. And that's what we're seeing in the industry right now through all of our different surveys, is that employees are feeling a little more optimistic than they were even 6 to 8 months ago, which is good news. The other good news is that of all of the 12 topics that we asked about, 11 of them had an improvement. So there has been tangible improvement in the last 6 to 8 months. So this is where I don't want your eyes to glaze over. Hang in there with me. I'm going to talk you through this. It's going to be okay. So I want to give you an orientation so that you understand what we're looking at. So one of the big improvements was this topic. Overall, I feel less stressed than I did a year ago. So remember, we ask an agreement score, we ask an importance score. One of the other questions we ask is, how likely are you to still be with your company a year from now? And taking those 3 data points into consideration, we have an algorithm that gives us a score from 1 to 100. 100 is the highest score you can get. That means that we have high agreement, we have high importance, and I'm sticking around with my company. And the other end of the scale, if we gave a score of a 1, that would be, this is very important to me, the lowest agreement, and I'm not sticking around. So you can see for 2021, do I have a little pointer here? 2021, we had a score of 56, and you're probably thinking, like, that doesn't sound like a very good score. It's not. You are exactly right. That's a horrible score. But we moved the needle 7 points to 63. Still not a great score, but when I see an increase of 2 or 3 points, I celebrate. I'm like, all right, we've got some traction. We're moving the needle. People are feeling something is different now than it was previously. So when I see a jump of 7 points, something has changed. So there's significantly less stress. We have a ways to go, because success in my book is to see a score of 85 or above. That's when I feel like, all right, we're rocking, we're doing really well. We're not at 85. We have a ways to go, but we're moving in the right direction. Now, on our agreement and importance score, we use a rating scale of 1 to 5. So you'll see in this little green box, we've got an importance score. The average importance score was 4.4 on a scale of 1 to 5, so high importance. On the agreement side, we had a score of 3.17. So the average level of agreement of those 3,600 participants was 3.17. And right below it, you're going to see a distribution of scores. So you can see the percentage of people who said in the green, this is totally important to me, 59.6%, this is totally important topic to me. And then you can see that distribution of important, neutral, unimportant, and on the left is totally unimportant. Now in the blue, that represents agreement. So you can see that only 26.2% say, I totally agree with this statement. And if you just scan over those blue bars, it's a pretty broad spectrum. It's pretty evenly distributed. So we're seeing a pretty wide spectrum of experiences throughout our industry. So while we may have 26% who say, I totally agree with this statement, I'm totally less stressed than I was a year ago, we still have nearly 19% on the full other end of the scale saying, I do not agree with this. I totally disagree with this statement. So we see that spectrum. That's the kind of thing that I'm really interested in. Now, in our study that you'll all be able to download, and you'll probably see this, these spread out, there's a QR code where you're able to download the full white paper that has all of the data. So if you see one of those things, go ahead and scan that QR code so you can download the study and get all the detail, because I'm going to be painting with broad strokes. I want to give you the high-level information so that you have some gold nuggets to take back and talk about with your team and with your leadership. The other part of this, and I'm not going to go into detail, is we break it down by position. So you're able to see through each position how important is this topic, and how much do they agree with this topic. And what I'm always looking for is what are the differences of experiences? Because sometimes an on-site leasing team member is going to have a totally different experience than a corporate service team member. So don't worry, you're going to have all of this data in the white paper, so I will move kind of quickly through these. Another thing that we asked for is comments. And I wanted to select some comments that people gave that were representative of many of the comments that we saw. And so when it comes to that feeling of feeling less stressed, while we made some progress, we still do have a ways to go. And this is an example of one of the comments that was representative of what we saw over and over again. When an employee is requesting a short-term leave, they shouldn't have to go through so many steps just to get a weekly therapy appointment. I personally had to revert to telecalls and use it as my lunch versus being able to meet with my doctor and have the full experience of therapy. I made the sacrifice to show I'm a team player and I care about my role, but it doesn't take away from the fact that the process to get it approved was uncomfortable and a bit intrusive. Now, this is a big description of what we saw over and over again, of just that feeling of, I want to go reach out, I have access to get help, but I feel really uncomfortable of asking my manager, asking my supervisor, getting it approved. And so it's so important that when we're thinking about mental and emotional health, it is health. We wouldn't question a team member if they had to go to physical therapy on a weekly basis because of an injury that they were trying to rehabilitate. We wouldn't question anyone who's going in for a weekly treatment of some kind, whether it's chemo or radiation or some other kind of treatment. That's health. This is health too. And so we have to start opening that conversation and normalizing that conversation. Mental and emotional health is health. It shouldn't be any more uncomfortable to let your supervisor know, I have my appointment with my therapist this week, at 1 o'clock on Tuesday. Shouldn't be a problem. Should not be a problem. All right, so these are things we're going to go through kind of quickly because I want to get through all this great data, but you will be able to get the details in the white paper that you can download. So this topic, in the last month, my mental and emotional health has not interfered with my personal life. So this is big picture. We're asking them to kind of evaluate their entire life, not just their work life, but their entire life. Has my overall mental and emotional health not interfered with my personal life? In the fall, we were at a 58. Not a great score. But we increased by 7 points. Again, this huge 7-point movement where we're on the right track. We're at 65. Still have a ways to go, but we're seeing some incremental improvement. And again, we can see on the scores below, this is a really important topic. The average overall importance score for this was 4.54 on a scale of 1 to 5. You can see it's very right heavy on the green on those charts, right? Very important to our team members. But again, agreement, we have a pretty broad spectrum of experiences. It's kind of spread out. So we know that we have a ways to go, but we have seen improvement. We want to keep seeing that momentum. This was an example of the types of comments that we saw over and over again. I come in early, I stay late to finish work, I cover for anyone out sick, and I've not been able to take a day off in 2 years. I have worked here alone for over 4 months of the last 2 years with no manager and no leasing agent. I am a single mother. I don't make enough to pay rent. Now, for some people, they might say, oh, this is just a one-off. You know what? I saw many, many comments very similar to this. And I think it's important for us to acknowledge, now, we've got staffing issues, right? How many of you are fully staffed right now, either at your property or in your portfolio? Unicorn in the wild, everyone. It's a unicorn. Congratulations. That is amazing. I am very happy for you and for your team members. That is no small thing. As we all know, it is so hard to find and keep and retain a full staff right now. One of our biggest challenges, and when it happens, we're like, yes, and we need to celebrate it because it is a big deal. But the thing is, we have staffing shortages, and it is causing things like this where people are feeling at their wits' end. It is affecting their mental and emotional well-being because they're just trying to get through their day, they're just trying to get their paycheck, and they're trying to take care of themselves and their families. And it's not easy, and it can become very, very heavy burden to bear. Now this one, I think this is one of my favorite questions. I feel emotionally well. Now think about this. 3,600 people in our industry were sitting there taking a survey, and they read this topic, and they had to sit and think about it. This might be the first time in their whole life where they did an emotional scan of themselves. That's pretty remarkable to me, of just having everyone be like, do I feel emotionally well? I don't know. But what we saw is that there was an increase. We went from 66 on a scale of 1 to 100 this fall, jumped up to a 71. So we had a 5-point increase. That's significant. Now, we still have a ways to go, right? We're still not at 85, but we're in the 70s. We're making progress. And the other thing that was really exciting for me is we saw, yes, this is very important, the overall average importance score, 4.57 on a 5-point scale. Very important. But when we look at agreement, we're starting to see things kind of skew to the right just a little bit. People are feeling a little more in agreement with this topic. It's not quite as broad of a spectrum of experiences as some of the other things that we've just looked at. So that to me was really, really exciting. We saw a lot of comments along this particular vein. I would like to see less pushback and judgment from management when there is an emotional stress and you need to take a day off. Check in with your employees. Ask how they can be supported and how they're doing. People sometimes need a break. We all need a break. Sometimes we are at our wits' end and it's, I'm done, you know? And so we need to make sure that it's a comfortable environment for people to be able to raise their hand and say, I need to take a day. And if you think about it, you've probably been in this situation where in order for you to even request that day, that takes a lot of courage. It takes a lot of courage to admit to yourself, I'm at my breaking point. It takes a lot more courage to go to your supervisor and say, I need a day. Because you know that there is a risk involved. You know that there is a risk that they're going to look at you. And even if they say, okay, you get the look, right? We have to have part of this conversation of making it safe for people to say, I need a minute, I need a day, I need a couple of days, because I saw a whole lot of these comments. And I think that probably many of us can relate to this, of just feeling like, I didn't want to ask. I didn't want to ask. So those were some key improvements. And while we did see some great movement, we still have a ways to go. And there were 12 topics that we asked about specifically. And when we look at this and when you download the white paper, you're going to be able to dive in. And most of us, our initial response is, I want to fix everything. Let's fix everything. But we can't. We can't fix everything today. It's not going to happen. We have limited time. We have limited resources. We have limited staff. We have limited budget. And so we have to be very intentional, very purposeful about the things that we are going to focus on. So as we go through these key opportunities, I would like you to be thinking about what's one of these things that I have any impact on whatsoever that I can bring back to my company and we can focus some additional attention. Just one thing. Because when you can move the needle in one area, it has a remarkable ripple effect throughout these other parts of our lives. And so that's what I want you to be thinking about as we go through this information. All right. Some of you are reading this question and being like, well, I rarely feel stressed about my workload. I'm not going to ask you to tell me how you're feeling, but I rarely feel stressed about my workload. So, like I said, 11 out of the 12 topics improved, which was good. This one improved from 61 to 62, okay? So not a lot of change, but we did see some positive. And we see, again, the importance is pretty high, 4.27 on a 5-point scale. The agreement level didn't even reach a 3. It was 2.99. And you can see that distribution of responses in blue, very spread out across the spectrum of responses. So very different experiences. And this is one where I'm going to dive a little deeper because I think it's an important message for our industry to hear right now. How many regionals do I have in the room right now? Okay, everyone look around and look at those regionals. If you work with them and if they're okay with it, after this session, give them a hug And for those of you who maybe don't know those regionals, let them know that you see them. Give some heart hands. Because our regionals right now, more than any other time in my history of working in this industry, and in 15 years of doing employee-related surveys, I have never seen the flight risk that I am seeing with regionals right now. Right now, 20 to 25% of our regionals are not sure if they want to do this anymore. I see some nodding heads, and I hear some ouch. Yeah. What if you lost a quarter of your regionals next week? Not good. So they knew what they got themselves into. You know, when they started, regionals never been an easy job. Never will be an easy job. It's a challenging job. It's an important job. They keep things on track. But if you see this on this particular question, I rarely feel stressed about my workload. The lowest scores come from regionals, both on the operator side and on the supplier side. We need to be aware of that because they have been managing up throughout the pandemic and managing down. They've been trying to tell leadership what their on-site teams desperately need. And they've been having to deliver some very difficult news to their on-site team members on a regular basis, sometimes on a daily basis. This is how we're doing this today, and here's how we're doing this today, and here's how we're doing this today. And the on-site team going like, oh my gosh, are you kidding me? They want us to do what and how? Did anyone bother to ask us? There are like 50 other better ways to do that. Right? And the regional's like, I'm just the messenger, sorry. They're in a tough spot. And in addition to having to deliver this difficult news on a daily, weekly basis for 2 years, they also had to be the ultimate cheerleaders, right? You're doing great. Keep it up. Proud of you. Here's some cookies. Here's some more PPE. Right? Rah, rah. And who's doing that for them? Nobody. Nobody. So hug a regional today. Say thank you. Give them some cookies. Anything. Let them know that you see them and you appreciate them because they are awesome. Regionals. And a message from your sponsor, stop loading properties with too many new things. Knock it off. Please. And we'll talk about some of the things that have been helpful. Some of the new things that have gone out have been great. New technologies helping to streamline. There have been some good things, but you know what? We got to turn the faucet off just a little bit. They got things going on. Not helping. The demands of my job rarely interfere with my personal life. Guess who scored lowest on this one? I'll give you one guess. It starts with an R and it ends with an regional. You know, and they knew what they were getting into. This is part of the job. You know, it all bleeds in to your personal life and just what you're doing every day, but it's rough, and we just need to be cognizant of it. Just be aware. Before you ask them to do one additional thing, just stop and say, does that need to happen this week? Or can we wait? Is there some other way we can handle this from a leadership perspective? We did go from a 62 to a 68, which is good. 6-point increase, that's a significant increase. We're still in the 60s, we still have a ways to go. But again, I like to look at this distribution. It's a pretty broad spectrum of experiences. So while some people are saying like, doesn't interfere with my personal life, leasing scored the highest here. You know, because leasing in general, not always, but in general, they're able to go and start work, and at the end of the day, they're able to leave work. And they can just leave it behind them many times. Other positions, not so much. I won't beat that dead horse, but you know what I'm talking about. So this was, again, you'll see a common theme with the comments, because there were so many things having to do with workload and having to do with what's being asked of me or what I feel like I have to do. Working every other weekend has really taken a toll on my mental health. It would be nice if the offices were closed on Sundays just to get a break in between the work weeks. If I'm working Saturday and Sunday, I'm working 7 straight days in a row. It takes a toll mentally. It would be nice to have a break. Now, again, I'm choosing comments that are representative of a theme I would see over and over again. So this wasn't just one person. This was many people saying that they're working 7 days a week in some cases. So as leaders, this is something that we have to be willing to take a look at. Because now that moratoriums have lifted, there's restrictions have started to lift, a lot of leaders in our industry are like, all right, let's get back to work as usual. Everyone in the office, and we're going to do everything exactly the same as we did in 2019. And you know what? Not going to work. We don't have the staff to do it. We have had a taste of flexible work schedules or working from home. We see the possibilities because we saw that it worked. We saw that we did just fine. Business did just fine. And in many cases, these were some of the best, most profitable years we've had, surprisingly enough. And so we need leaders to take a look at this and say, okay, well, what if we closed our offices 1 day a week? Because I've heard from a lot of companies who have done this. They've closed their office 1 day a week, and guess what? The residents thought. They didn't care. It did not bother them because there was communication. They were told what the plan was. They were told when the office would be open. And they were like, all right. So we need to be willing to try some new things and not just assume that it's going to be the end of the world from our resident experience. Not the case. Not the case. All right, my company's culture encourages a reasonable balance between work and personal life. Now, this was one I was pleasantly surprised. We saw a 2-point increase, 69 up to a 71. We broke the 70s. Again, still not at the 85 that I would love to see us at, but we're moving in the right direction. And on the agreement side of things, if you look at the bottom chart, we're seeing a little bit of a skew to the right, toward the agreement side, which is good. That's a good story that we want to see. But what's interesting to me is I love looking at those who select the neutral option. On a scale of 1 to 5, they chose a 3. And that's either I don't know, or I'm not willing to say. And we saw a lot of this. In this case, it was pretty common that we saw 1 out of 5 respondents not knowing or not being willing to say what their actual opinion was. They wanted to participate in the survey, but they weren't quite ready to take that leap and say, yeah, this is terrible, or I feel terrible. And so seeing that 21% in the neutral zone, right in the middle, shows us that we have a lot of work to do, and just, again, making a safe environment for people to be able to say, this is how I feel. This is my experience. This is my perception of what's going on right now. You know, I was talking with, I don't know if Amanda Edwards is in here from WPL. I was talking with her yesterday about her team. We asked a question on our employee engagement surveys of, I'm able to work, or able to complete my work in the amount of time allowed. We're trying to find out about workload. Do they feel like they can get their work done every day? And at WPL, they achieved the highest score out of all of our clients. And so I was asking her, like, how do you guys do this? Because this is a real problem in our industry. This is one of the biggest opportunities in our industry of people feeling like they cannot get their work done. They feel like they're on a hamster wheel. They can't get their work done. And yet your team is like, yeah, it's the best score in the industry. How do you do that? And I love what she said, because she said, you know, me and my counterpart, we both grew up on site. You know, we were leasing agents. We were property managers. We've been and worked on site, and we know what it's like as a property manager and all the different things you are trying to manage every single day. And she's like, we try and really keep that top of mind when we call a site and we ask the property manager for something that we need immediately. We are very aware that our task is not the only task that they are required to do in the next 5 to 8 hours. We know all the other things they have going on. So we're very, very cognizant of that, and we really hold back on a lot of our requests. If we can do it another way, we're going to do it another way. And if we have a task, we're going to make sure that they get spread out. And we're not asking them 5 things today that are all due by the end of the day, because it's not realistic. And I loved that. Just having awareness, just having the awareness of what your team is really dealing with on a daily basis. And this was a big thing. Employees should know that they are allowed to take vacations instead of feeling too anxious to request time off due to a real or perceived hardship on their colleagues. Here's the thing. Based on all of our research, in our industry, we actually like each other. We actually like most of our coworkers. That's some of the highest scores that we see, is that I have good relationships with my coworkers. I have good relationships with the other departments in my company. There are exceptions, yes, but by and large, we like each other. And so if I'm burnt out and I know there's only one other team member available, I have a really hard time saying, I got to get out of here for a week because I know you're going to be stuck with everything. But I like you. I don't want to do that to you. So I'm going to forego my vacation. I'm going to hang in there a little longer. I'm going to burn myself out a little bit more because I like you. Which I guess is a good problem to have in some respects, but man, we have to be able to take that time. And we have to be able to, as a leadership and as managers, to create the space for people to feel comfortable in, hey, if you take this time off, we're going to have you covered. We're going to get creative in making sure that these things are covered so that your coworker is not drowning. Those are the things that we need to be thinking about. Employee well-being is a priority at my company. Well, we saw improvement, technically. We went from a 71 to a 72. We're in the 70s. Trying to find the, silver lining here. This was surprising to me because I feel like, and tell me if I'm wrong, I feel like over the past 6 to 8 months in our industry, we've been talking a lot more about well-being, about mental and emotional health, and having that awareness. Who agrees with me? Do we feel like we've been hearing and seeing more about it in general? Okay, so half of you are like, yeah, all right, I'll buy into that. But I didn't see this on a company level. I didn't see a bump up of employees saying, yeah, at my company, there is a priority, there is a focus. And in fact, see that neutral zone right in the middle? 20%? That's 1 out of 5 saying, I don't know if employee well-being is a priority at my company. Or they're saying, I don't think I want to say. I don't want to admit if I agree or disagree. We got a ways to go. So think about that. Think about at your organization, how do you communicate that well-being is a priority? Do you talk about it? Do you point out your resources available? What do you do, to make sure that they do know? Because I wish this was the only comment I got like this, but this one cracked me. I mean, it was like, please do not hire condescending motivational speakers giving webinars and calling it caring for your mental health. Oh, yeah. I mean, I think from a leadership perspective, they wanted to do something. We know the intent was there, or maybe they just wanted to check a box, I don't know. But this is not going to work. The once a year motivational speaker saying, hang in there, you're doing great, go take a bubble bath. It's not going to work. It's not what we're talking about here. The other part that I thought was interesting is this, and this again, this was a theme that I saw over and over again. The company priorities seem directly opposed to health of non-corporate employees. It appears as though support is offered to corporate leadership, but frontline employees are not offered tangible support. I got to admit, when I was working on the operator side, I felt this, I saw this. At one point, they brought in a yoga instructor once or twice a week during lunchtime to do yoga. Did I participate? Absolutely. Did they have yoga instructors go out to the sites? Absolutely not. And at the time, we enjoyed that benefit, but it's not equitable. It's not accessible to everyone. And who are the ones that really, really need yoga? I mean, besides regionals. I mean, think about the conversations your on-site people have every single day. They're not easy. They need a little stress release. Okay, my company offers resources and help support employee. Let me try again. My company offers resources to help support employee mental and emotional health. All right, increase, good, 74 to a 76, still not in the 80s, but 23.6% answered 3 on a scale of 1 to 5. I don't know if my company offers resources to help support employee mental and emotional health, or I don't want to say. Got some work to do. Got some work to do. How do you promote what you have available? How do you know? How do your employees know where to go, where to look? Because here was some of the comments that we saw. The employer and health provider should offer periodic reminders of such resources instead of presenting them once a year during the yearly health insurance renewal. How many of us rely on open enrollment to highlight what's available to our employees? Are we talking about the EAPs, the employee assistance programs? Have we demystified what that is? Do your employees know that it's free? Do they know that it's confidential? Do they know what happens when they actually make the phone call? Some people are scared to death of what happens after someone picks up on the other end. They don't know what's going to happen. We need to demystify that to make it accessible, to make it feel safe, and let them know no one's going to know. It's your business. It's between you and you. That's it. We need to make it accessible. We need to make it safe. So how are you promoting what's available to your team members? Very quickly, I'm just going to cover a couple of other stats. I'm going to hand this off to Jean to talk about what's happening next at the National Apartment Association level and the partnership that we formed with the Wellness Council. We asked the question, I know this is tiny, but again, when you download the report, you're going to be able to see all these details by position. But we asked, in the past year, how many days did you take off work due to not feeling emotionally well enough to perform your job? Okay, this is absenteeism. These are people who have to not work because they need a break. So we've got 60% of our respondents who said, I didn't take any days off. But we had 40% who took at least a day. And in fact, we had 10% who took between 1 and 2 weeks off. 10%. That's 360 people, 360 respondents just on this survey who said, I took between a week and 2 weeks off because I did not feel emotionally well. That's pretty significant. And we also asked, how likely are you to stay with the company for the next 12 months? Okay, this is a leading indicator. Are you going to stick around? We had 9%, nearly 1 out of 10 saying, unlikely. An additional 15% who are neutral, not sure. And we have that broken down by position as well. So this is, how do we get our leaders to pay attention to this kind of stuff? This is a money matter. When you have people who are not coming to work or not on their A game for a lot of the time that they are at work, you're not getting things done. You're not productive. You're not running an efficient business. You are losing money. Let me spell that out. You are losing money. So this is something that we need to pay attention to make sure that we have what is in place to support our team members to do their best work and to have access to the support and resources they need so that they can do the work that you've hired them to do and that they enjoy doing. They want to be there. But we've got to make sure they have the tools to be able to do that work. So with that, I'm going to turn it over to Jean to talk about what comes next.
Thank you so much. Thanks for all the data. It was the first time I got a chance to see it too. And I'm not sure if I should introduce myself by saying, hi, I'm a condescending motivational speaker here to talk about mental well-being. I know. I'm Jean Supin. I'm with the National Council for Mental Well-Being, so I have no idea if I'm going to be a condescending motivational speaker, but I'm really excited about the partnership that we are building and growing and deepening with all of you and the National Apartment Association. So we got a very weird, out of the blue phone call about a little over a year ago, I think. And I don't think I've ever actually told James and John this, but we had no idea why they were calling. We thought they were calling about a management training that I do. And within about a second and a half, I realized, oh no, they're not calling about that at all. And so I quickly regrouped. I have been a consultant with the National Council for Mental Wellbeing for over 20 years. I am not a clinician, I am not a therapist, I'm not a psychologist or a psychiatrist. I actually do leadership development, but I do it in that space. And we got this random phone call, and it was the National Apartment Association reaching out and saying, we think we've got some challenges in our industry among our membership. And we've been trying to figure out how to identify what those mental health and substance use challenges might be. And more importantly, we're trying to figure out how to help. And we realized we need some folks who actually do this for a living. And so over the course of a couple of months, we figured out a way, and on top of that, they said, and we want a long-term relationship. We don't want like a one-off training or webinar. Instead, we really want to do this right, and we really want to do this in partnership and collaboration, and we really want to learn from our membership what folks really need. And then we want the National Council to help us provide that. So the National Council, a little bit of history, we've been around forever. We're also an association. We have approximately 3,000 to 4,000 members, organizations. Members are organizations that provide mental health and substance use recovery services all over the country. As you can see, our mission is to make mental well-being, which is thriving regardless of mental health or substance use challenges, a reality for everyone. And we've got, real quickly, just so you know, we're supposed to be long-term partners with you, so I want to make sure you know who we are. We do several key things. We build capacity among our members, again, providers of services. So we help them get better at what they do. We provide consulting, we provide training, we provide technical assistance. We also are kind of on top of what are the best resources? What are the best clinical approaches? What are the best supports? What are the best clinical philosophies that we should be offering to those we serve? And then we sort of disseminate that and help providers, therapists, psychologists, clinics be the best that they can be. We also, as a membership organization, we advocate a bunch in DC on Capitol Hill and in state legislatures all around the country. So we advocate on behalf of the folks that we serve and the agencies that provide those services. And then finally, we do education and collaboration with folks whose day-to-day are not in the mental health or substance use world. So we have a signature program called Mental Health First Aid, which I'll talk about a little bit more in a moment. We too have an annual conference. It's not 14,000 people, but it's pretty big. It's about 5,000 or 6,000 people. We do lots and lots of webinars, lots and lots of learning communities, lots and lots of training, so we're sort of everywhere doing all sorts of stuff. And, our goal, obviously, similar to your association, our goal is to deliver results and make an impact. So a couple of things that just a reminder, these are statistics that are not just for your industry or for any individual industry. These are just numbers that remind us that, most everybody either knows somebody or maybe has mental health and substance use challenges. I don't go anywhere in my personal life or my professional life when I don't mention that I work in the mental health field, that somebody doesn't come up to me and tell me a story. And this is just a reminder of how it affects us in our work lives. 10.8 million full-time workers have a substance use disorder. 200 million work days are lost each year. due to a mental health challenge. Again, that's across all industries. Less than 10% of employees feel their workplace is free of stigmas about mental health. So the findings that Jen just shared with you are similar to findings we know about all over the country in every industry. So again, we got this random phone call, and then we are creating this amazing, exciting partnership, or at least it's amazing and exciting to us. Again, NAA asked from the get-go that they wanted it to be long-term. They wanted to blend expertise, your expertise and our expertise, and then partner really closely with Swift Bunny and Jen to help design and deliver and understand the results of ongoing surveys about mental well-being. And then we're bringing to you, again, in a spirit of partnership and a spirit of collaboration, again, and not condescending motivational speaking, but we have some stuff that will probably be helpful. First and foremost, we are offering a mental health first aid training and a mental health first aid at work training. These again are signature offerings the National Council's been doing for years with industries and businesses and corporations all over the country. And if you think about, when you learn physical first aid, and you learn how to help somebody if they're choking or if they suddenly, sort of fall on the floor. It's similar. It's offering for anybody and everybody. If you suddenly find yourself with or close to someone who's having a mental health challenge, it gives you some knowledge and some tools to be supportive. It ain't gonna turn you into a therapist, nor is it gonna ask you to serve as a therapist. Instead, it's just a training to design to help you feel a little more comfortable with a situation that often is really scary and really uncomfortable. So we're sort of launching those trainings across your industry. NAA will be sponsoring some, and then others of you your companies may be sponsoring some. I know some of you, John, for example, and others will also be going through training to become trainers. And then we're sort of diving into whatever else you might need: training, support, information, train the trainer, whatever it might be. We collaboratively did host a couple of webinars in May in honor of Mental Health Awareness Month. So we offered 3 trainings, again, in partnership, and we're hoping to do lots more, and we're hoping to tailor the topics and tailor the approach to best meet your needs. And then we got members all over the country. We got some of the best therapists and clinics and services in the country. And so they're located, down the street from your offices, down the street from your apartment complexes, down the street from where you live. And so over time, we're hoping to be able to both informally and maybe formally create some bridges. So when folks are struggling, maybe it's you, maybe it's a colleague, maybe it's an employee, maybe it's a family member, that you know where to go and that it's an easy way to get there. And again, there's some other slides. In the interest of time, I'm going to go through them, but there are more information about mental health first aid. Most importantly, though, at 4 o'clock, ignore that time. It's at 4 o'clock, not 4:30. My colleague, Tremaine, stand up. My colleague, Tremaine, will be doing a full-blown presentation on what mental health at first aid offers. And again, I'll go through this. But what I want to end with is merely talking about mental health and substance use challenges often begins relief. We mistakenly, I do too, mistakenly believe if we mention the topic, we're opening some kind of Pandora's box that we can't get closed. and that we're going to get sort of inundated with talking about topics we can't handle. And the truth is, it's just the opposite. You don't have to be an expert in this field, and those of you who are leaders, you don't have to take care of it and fix it and suddenly miraculously say the magic thing that will allow people to feel better, but just acknowledging that someone, that me, that you, that anyone is experiencing sort of a mental health moment. Just acknowledging it, even if you fumble through it, is better than ignoring it. And so that's why we're partnering, and that's what we're hoping to provide as you continue to deliver for yourselves and your colleagues and your membership exactly what the times demand. So thanks.
Thank you, Gina. Thank you so much. So you can see why I'm excited about this partnership. We got to wrap up. A couple of things just real quick. Mental health, we all have it. Every human being on the planet has some state of mental health, right? They may not have high cholesterol, high blood pressure, but we all have mental health. So we invite you to come to our session this afternoon at, yeah, it's in room 23, I think. It's over on the other side. But that's where we're going to talk about Train the Trainer, the mental health first aid training, and Train the Trainer. NAA for the first time is going to have training for mental health, so we're excited. So thank you all for joining us today. We do have a poll. I got to get to the poll real quick. Apologize for that. Or the survey. Fill out the survey about this session. Hopefully you learned some insightful things in here today, and we appreciate y'all bringing with us today. All right, so we hope to see you this afternoon. Thanks.